Welcome back to the MBI Health Podcast. I'm Dr. John Neustadt, co-founder and president of MBI. This podcast segment is part 2 of my discussion on bone health and osteoporosis. In this podcast, I will discuss the evidence for using calcium, vitamin D, vitamin K2, specifically the MK4 and MK7 forms of vitamin K2, magnesium, soy isoflavones, and boron for their ability to grow stronger bones. All of these nutrients are commonly found in bone health or osteoporosis dietary supplements, and that's why I'd like to focus on them today. In this recording, I will discuss the results in published human clinical trials on fracture reduction for 2 reasons. First, clinical trials are the highest form of evidence, and if you or your doctor is going to make the best possible decision on what to do in terms of taking a nutrient or a dietary supplement, it should be based on the best evidence available. Second, the most important thing to consider is whether that nutrient or combination of nutrients have ever been shown to reduce fractures. Because after all, fractures are the most dangerous aspect of osteoporosis. If you have osteoporosis and you break a hip, there's a 20% chance of dying within the year. If you happen to survive that first year, you have a 20% chance of ending up in nursing home care with chronic, debilitating pain. People say that, well, what about my bone density scan? Isn't that important? A bone density scan is only as important as it can predict fractures. And bone density only predicts 44% of women who will get a fracture and only 21% of men. For a more in-depth discussion of this, I recommend you do listen to part 1 of this podcast on bone health that's available in our archives. So let's simply lump the nutrients into 2 general categories: those shown to reduce fractures and those that have never been shown to reduce fractures. This should be a nice categorization that can help us begin to wrap our minds around these ideas and understand which nutrients have the most clinical evidence available to them. Published studies show that calcium, vitamin D, and the MK4 form of vitamin K2 can all reduce fractures. However, the rest of the nutrients, the MK7 form of vitamin K2, magnesium, soy isoflavones, boron, none of these have ever been shown to reduce fractures ever in any clinical trial. In fact, there was a clinical trial published a few years ago that concluded that MK7, in fact, did not reduce fractures. Now, people take calcium and vitamin D. It's very popular. You see a lot of advertisements on the television and internet for calcium and vitamin D for bone health. It's recommended by many doctors, but most people don't stop and ask, and frankly, most doctors don't stop and ask the question, by how much does calcium and vitamin D actually reduce osteoporosis fracture risk? Calcium and vitamin D, after all, are approved by the US FDA for osteoporosis. But again, how much do they actually reduce fracture risk? Most people are surprised to learn that the published studies show that calcium and vitamin D only reduce fracture risk by about 16%. Wow, that's nothing to laugh at, and any improvement or reduction in fracture risk shown in studies is important to think about and take a look at. We can do better than that. And in fact, the published studies show that you can do better than that for your health. MK4, that form of vitamin K2, has been studied for more than 20 years for its ability to grow stronger bones. In fact, it's been approved as a medication in Japan since 1995 for the treatment of osteoporosis and the treatment of the pain caused by osteoporosis. When you get fractures from osteoporosis, even if they're small fractures called microfractures that can frequently occur in the vertebrae, for example in the spinal column, you can get pain, chronic pain. And in Japan, since 1995, again, MK4 has been used as a treatment in the amount of 45 milligrams per day for osteoporosis. Now, MK4 is a form of vitamin K, and vitamin K is used for blood clotting in the body. And some people will look at this dose, which is a high dose, higher than you find in most dietary supplements, and say, it'll increase my risk for blood clotting. In fact, I've had people come back and ask me and tell me, my doctor has told me that this will cause a blood clot, that this will kill me. And I have to explain to them that the doctor is ignorant about the research, ignorant about the history of MK4, and ignorant about the biochemistry of vitamin K and how the body uses it. So let me take a moment to just discuss that. Yes, vitamin K, the MK4 form, the vitamin K1 form, the MK7 form, all of those can be used for blood clotting. However, once your body has enough vitamin K for healthy blood clotting, it cannot clot any faster. It's like a conveyor belt. Once that conveyor belt is going at an optimal speed or a maximum speed, it simply can't go any faster. The vitamin K then goes on to do other things. It goes on to the bones, for example, to help produce collagen, the connective tissue in the bone. It has been shown to reduce inflammatory markers. Since one nutrient is often used for many different roles in the body, the MK4 has actually been shown also to help promote healthy cell growth, both in test tube studies of cancer, but also in human clinical trials of acute myeloid leukemia and myelodysplastic syndrome, as well as liver cancer. Those are all done overseas in Japan, published human clinical trials and case reports, and that's why some people are using the MK4 nutrient now with the vitamin D, because in one study that combination showed to have the best results for oncology support, why they're using those now for oncology support. And you can find out more information on that on our nbihealth.com website if you'd like. But back to the discussion on bone health and osteoporosis. Since it has been approved for so long in Japan, there's a lot of information out there available, published clinical trials, published in vitro data, that is test tube data, and long-term follow-up. There have been over 6,000 patients that have been taking MK4 45 milligrams a day or more for 6 years or longer. Even some of those people with kidney failure and liver failure and myelofibrosis, which is a scarring or a fibrosis in the bone marrow, they have taken that for 6 years or more without any indication of any dangerous adverse effects. That includes no increased risk for blood clotting. And studies show of up to 135 milligrams a day of the MK4 in humans and over 200 milligrams per kilogram body weight in animals have not shown any increased risk for blood clotting. So that concern about increased risk for blood clotting is just simply unfounded, and the opposite is true. It actually has been shown not to have that effect. And in one study, an animal study of MK4, the MK4 was actually shown to stop and reverse the calcium buildup in the arteries. One pet peeve that I have on the internet is that there's a lot of information put out there on websites, especially for dietary supplements, that are not supported by the evidence, by citations on the website. Last year I was visiting one website, and they had a dietary supplement with a form of vitamin K in it, specifically MK7, and the websites talked about how it's so important for bone health, and also how vitamin K2 has been shown to reduce calcifications in the artery. But then you look at the actual ingredients and it's MK7, but what they don't tell you is the MK4 form was what was used in the study, not the MK7 form. And in fact, MK7 also has never been shown to reduce fractures. And in addition to that, just because it's in the same category of vitamin K2 molecules does not mean that it acts the same. For example, when you talk about oncology support, MK4 has been shown to have very potent, very powerful mechanisms for reducing cancer cells in test tubes. It's also been shown to promote healthy cells in human clinical trials. MK7, in contrast, does not have any appreciable anti-cancer activity as shown in test tube studies. So just because it's in the same category of vitamin K2 molecules does not mean that they function the same in the body. And in fact, I would encourage people when they're looking at websites and they see claims or statements being made, especially where they're talking about research, look for a citation. If you don't see a citation there that you can click on and actually see the study or read the study, contact the company and make sure that the actual molecule that was used in the study that they're citing to support their formula is not only the actual molecule that's being used in the formula, but also in the correct dose, in the dose that was used by the clinical trials to support its use. that's what I'd recommend. I think that the educated consumer is the best consumer, and if this podcast helps people focus their energy and attention more on how to sift through the vast, just the reams of data and information out there on the internet to make the best choices, then I think that's wonderful. Back to bone health and osteoporosis and MK4. MK4 in clinical trials has been shown to reduce fractures up to 87%. It's been shown to reduce fractures with calcium and vitamin D by that amount. It's been shown in some clinical trials to reduce fractures when MK4 was paired with Fosamax. And so it can be taken safely with the conventional medications if people are taking those. And research shows that it may actually have a synergistic or enhancing effect for those medications. So MK4, 45 milligrams a day, has been shown in many different populations, including patients with Alzheimer's disease, with osteoporosis, Parkinson's disease, and many other studies which are all listed on our website, mbihealth.com, to reduce fractures up to 87%. Calcium and vitamin D, again, have not been shown to reduce fractures by more than about 16%, but when they're combined with the MK4, that goes up to 87%. Very, very powerful and very impressive. And that's why we formulated our OsteoK product with the 45 milligrams of the MK4 plus calcium and vitamin D. Let me talk for a moment about magnesium, because even just this morning I got a call from a customer asking me, well, there's no magnesium in your OsteoK products. Should I be taking magnesium? I heard that magnesium is required to absorb calcium. The reality is, and I keep asking people, is that I don't know of any study that's ever shown that. It's a very popular idea amongst people, but I would love somebody to please show me a study that does show that it's required. And frankly, magnesium, again, has never been shown to reduce fractures. In the studies that were done in Japan that showed the MK4 reduces fractures by the incredible 87%, did not use any magnesium. They only used calcium and vitamin D. So magnesium, simply stated, is not required to get those bone health benefits from the MK4, but I'm a big fan of magnesium. But for bone health and osteoporosis specifically, the evidence just doesn't support that it is required. Magnesium is used for over 350 biochemical processes in the body. It's a very nice nutrient to have, and so, but for bone health and osteoporosis specifically, it's just simply not supported by the research. So you can look at these two general categories very quickly: the soy isoflavones, boron, magnesium, MK7. None of those have ever been shown to reduce fractures. Fractures are the most important thing about osteoporosis and bone health that you want to be concerned about. The only nutrients in this podcast that I've discussed that have been shown to reduce fractures in human studies are the calcium and vitamin D and the MK4 in the amount of 45 milligrams a day. I hope this podcast is helpful for you. You may find more information on our website, www.nbihealth.com. Thank you very much, and tune in next time for our next installment of the MBI Health Podcast.